Brad, why can't, or can you tell us about some of the pros and cons of an epidural?
Yes. Some of the pros would be when a woman is going into labor, it can help with her pain. It can make it where she is not in as much pain and can enjoy the actual labor process. And another pro would be that a quicker recovery time for the woman, and also too, it varies from patient to patient, but it can shorten the actual recovery time for the female. And as we go into the cons, as we said, it can shorten the labor process. It can also prolong the labor process, but it just depends and varies from patient to patient. But some of the other cons would be uneven numbness in the body. It may numb the right leg, and the left leg not numb it at all. So there's there are some different side effects that it could numb one half of the body and not the other half. And it can also affect the baby's breathing during labor. And the epidural is not given until I'd say about 5 or 6 centimeters. When the woman is 5 or 6 centimeters dilated is normally about when it's given. And during that time, that's when the baby needs to be the most active, so that it I'd say hurries the labor process or keeps it on track and doesn't slow it down. And so that's one of the cons would be it slows the baby's heart rate and speed, so it's not moving as much. Therefore, it could be prolong the actual labor process, and possibly cause a C-section because of that. Some women, once they get the epidural, it can stop their labor process altogether. So it's good on one hand, and it can have some side effects on the other hand. But epidurals, they really help women when they're in labor, and people with back problems also help. It can last for months or it can last for weeks, but epidurals are very helpful when it comes to labor.
Okay. Can you tell us about any of the side effects, maybe post-epidural, I guess?
Side effects post-epidural?
What are some ongoing side effects that they may experience after receiving an epidural?
Well, one side effect could be if the area is not cleaned good, it can have an infection. Therefore, it could cause further, I'd say, problems with the person whoever receives the epidural. It can also cause bleeding, internal bleeding, and that's normally that'd be higher in your patients that have some form of hemophilia, is what that would normally be related to. But other than those two, it could, trauma from the needle in that area could cause pain, and the bleeding could actually cause some infection as well. But other than that, I'd say some of them, some side effects would be bladder dysfunction as well. And but other than that, it's normally a decent recovery time, and like I say, it varies from patient to patient. And some of them, most don't have any side effects at all, but side effects are possible.
Okay. Well, Brad, thank you so much for your time, and thanks for answering all my questions.
Absolutely, absolutely. Thank y'all very much.
You can cut.